Hello everyone, myself Monamika Nunisa, student of Lakhimpur College of Veterinary Science. Here in this video, I am going to discuss about the disease called bloat. Here I will include its types, etiology, epidemiology, pathogenesis, clinical findings, necropsy findings, diagnosis, treatment, prevention and control. First, let us start with the introduction. The synonym of the disease is ruminal tympani. Bloat is an excessive accumulation of gas in the rumen. As we all know that in rumen, the food is fermented by microbes which produces gas and is generally expelled out from the rumen by eructation. Hence, bloat occurs when this gas becomes trapped in the rumen. This disease is characterized by the distension of left dorsal abdominal wall, especially at the left paralumbar fossa. The death rates as high as 20% are recorded. Types of bloat. There are two types of bloat. The first one is the primary bloat. It is dietary in origin and occurs due to ingestion of legumes or legumes dominant pastures such as red clover, white clover, ladino, alfalfa leaves, and also excessive grains. This type is also known as frothy bloat. The second one is the secondary bloat, which occurs due to the failure of eructation of free gas because of physical interference with eructation. This type is also known as free gas bloat. Etiology. Frothy bloat. It is caused by the production of foam that traps the normal gases of fermentation in the rumen. The essential feature is that coalescence of the small gas bubbles is inhibited and intraruminal pressure increases because eructation cannot occur. It occurs in cattle consuming very succulent fodder, immature rapid growing legumes. It also occurs in cattle which ingest cereal crops, cabbages, leguminous vegetable crops. The etiology of free gas bloat. It is due to the failure of eructation mechanism to remove the gas from rumen. The physical obstruction of eructation is caused by esophageal obstruction due to the foreign body or stenosis of esophagus. Interference with esophageal groove function in the vagus indigestion, diaphragmatic hernia, and obstruction of reticulo-omasal orifice. Epidemiology. Bloat occurs in dairy cattle which consume bloating forages. Spring and autumn are the most dangerous seasons when such forages are lush and young. Feeds with high moisture content, immature forage, and environmental factors such as rainfall and temperature have also been implicated in foam formation. In some cattle, the occurrence of frothy bloat is thought to be genetically influenced. High morbidity and mortality possible and cost of control makes the pasture bloat an economically important disease. Pathogenesis. In frothy bloat, the gas bubbles remain mixed with the rumen contents, which leads to the production of slime material from legume food or heavy growing pasture. It thus increases in the volume of the ruminoreticular contents and consequently inhibiting eructation. The characteristic frothiness of ruminal contents is caused by inadequate coalescence of gas bubbles. The pathogenesis of free gas bloat. Gas bubbles coalesces and separates from the rumen content and fluid. Animals cannot eructate the pockets of free gas because of abnormalities of the reticulorumen or esophagus. Clinical findings. Bloat is a common cause of sudden death in cattle. Feedlot cattle that die of bloat are commonly found dead in the morning, which may be from their relative inactivity during the night or to the lack of observation, detection and treatment. Dairy cattle that are being milked and observed regularly will commonly begin to bloat within 1 hour after being turned into a bloat-producing pasture. The other clinical findings are distension of the rumen, usually more obvious in the upper left paralumbar fossa. The animal may stand and lie down frequently. The animal may kick at its abdomen. There will be frequent defecation and urination. Dyspnea, extension of the head, protrusion of the tongue, salivation, mouth breathing, heart rate increase up to 100 to 120 per minute, respiratory rate increase up to 60 breaths per minute. Necropsy findings. Hindquarters are pale, while forequarters are congested. Cervical esophagus reveals congestion and hemorrhage. Thoracic portion of esophagus remains pale and blanched. Lungs are compressed and rumen distended with frothy ingesta. In par-acute cases where the animal suddenly dies, punctured wounds in the form of hole are seen in the rumen. Diagnosis. This disease can be diagnosed on the basis of history of feeding and clinical signs. The mild cases can be diagnosed by passing a stomach tube, which results in the escape of gas. This disease can be differentiated from the other diseases such as lightning stroke, black leg, anthrax, and snake bite. Lightning stroke. Singeing of hair with the history of lightning are important features to diagnose lightning stroke. Black leg. History of onset of black leg after the monsoon rains and characteristic symptoms of the disease are helpful to differentiate it from bloat. Anthrax. Passing of dark tarry unclotted blood from the natural orifices in anthrax. Snake bite. History of the snake bite and fang marks are helpful to differentiate them from par-acute or acute bloat. Treatment. Remove the animals from bloating pasture. Emergency rumenotomy in severe cases. Passage of the stomach tube or trocar and cannula, which is of 2.5 cm in diameter, can be inserted into the left paralumbar fossa to release the rumen foam and gases in the less severe cases. Antifoaming agent can be administered through the cannula and left in the place until the animal has returned to normal. Groundnut oil at a rate 250 to 500 ml or turpentine oil at a rate 15 to 30 ml orally can be administered. Ginger, asafoetida and garlic at a rate 10 gram each and at a rate 100 gram of onion should be ground well to form a paste and applied on tongue. Polozoline at the rate 2.5 to 5.0 gram used for leguminous bloat. Antibiotic like penicillin at the rate 22 to 50 million units or at the rate 15 to 30 ml of 10% formalin can be administered intraruminally. Prevention and control. The four major methods used for preventing frothy bloat includes pasture management, feeding of roughage supplements, administration of antibiotic like monoxin and oxytetracycline, use of anti-foaming agents, frothy bloat can be prevented by feeding at a rate 10 to 20 gram of poloxylin or groundnut oil at a rate 60 ml per adult cows daily in the ration. These are the references I have mentioned here. Thank you everyone for watching my video.